When a 56-year-old man was rushed into the OR with end-stage heart failure for a heart transplant, docs discovered a problem. The donor's heart was too small for the recipient, so the surgeons improvised and in a remarkable 7-hour surgery tucked the small donor heart in between the man's right lung and his original heart, giving him essentially two hearts, two different heartbeats. You may all be wondering, how does this work? How could this even happen? Well, we're joined by cardiologist Dr. Kahn via Skype to explain. Dr. Kahn, it's amazing to just look at the images of this. Talk to us about how unorthodox this is and how it might actually work.
Dr. Travis, can you imagine being an emergency room doctor and trying to interpret that electrocardiogram?
No, I cannot, sir.
Listen to them with a stethoscope.
Yeah,
Very confused.
What were you drinking? But actually what happens is your heart's over here beating, but in this 56-year-old man's case, the heart was beating very weak. They bring Spud Webb's heart into John Sally's body. Simply doesn't work. So they bring in the turbo heart. Happens to be the doctor showed turbo heart. That extra heart, the turbo heart, sits in the right chest by the lung, where the weak heart is in its normal position a little over by the left side. And then the cool thing is they put a pacemaker to both parts, so they're beating together. Beautiful Esther Williams synchronized swimming. So everything flows out in synchrony. It's a miracle.
Very nice.
This has been done 150 times in the world. 150 times only. So it's a very lucky man to get the turbo heart.
Dr. Kahn, how long is a transplant like this likely to last?
There is a 20-year survivor out there, which is wonderful that this 56-year-old man could make it into his 70s and beyond with all the chances. But overall, transplants are rare. You'd rather have the standard transplant than this double piggyback transplant. But you know what, in that situation, you take what you can get. This is really amazing that he made it through, and apparently is recovering quite well.
Well, Dr. Kahn, can't thank you enough for weighing in on this. The good news is, unlike our first story, no one at home can even consider trying this.
Yeah.
No.
That's
So
true.
complex and fascinating.
Yeah.
And again, good to hear that apparently the patient is doing well.